Welcome back to Fox 10 News at 4. I have Dr. Tammy Pugh with me, a certified registered nurse. I gave you a promotion.
Yes, you did. Thank you.
That's okay. A practitioner with Infirmary Health, the High Risk Breast Cancer Center. Thank you for being here.
Thank you for having me.
We are talking about breast cancer, and you said, and I guess I didn't realize this, but the older you get, the higher at risk you are.
Absolutely. And it's not that we can't develop breast cancer at a younger age, we certainly can, but that risk increases as we age, and there's a lot of factors to that. And a lot of it too could be just our lifestyle, and so it's so important that as we age that we get a handle on our lifestyle, that we make sure that we are exercising, staying quite active, managing and coping effectively with stress. Yes, which is hard to do nowadays.
Yes.
And really just making sure that we're staying current on our screenings.
Right.
Yeah.
Talking about that term, high risk, what is considered high risk?
So for an average risk woman, that lifetime risk is about 12%. But there are risk models that we use for someone that may have a family history of breast cancer, along with some other personal risk factors that could place their lifetime risk 20% or even higher. If there's a genetic mutation that is in the family that's being passed down, that lifetime risk can be as high as 84%.
What does a breast cancer plan look like?
So for a high-risk individual, and it is very individualized, but if they're high risk, meaning that tyrocusic, that risk model is over 20%, they may benefit from added surveillance. Now that may look differently for different people, but certainly still 3D mammography, incorporating halfway through the year with a breast MRI is certainly vitally important. If they don't meet criteria for the MRI, then there are other screening modalities that we can implement halfway through the year. And the reason we do that is so that we can provide that early detection should something form.
Right, and we have to get those preventative screenings, and we also have to notice when something is changing and then speak up.
Absolutely. And something that is important that some women don't know, not all breast cancer forms a lump. And so even though you have normal imaging, let's say 4 or 6 weeks later down the road, you're finding that there are changes of the skin, the texture of the skin looks different, or maybe there's some nipple abnormalities. Those things need to be brought to your doctor's attention so that follow-up imaging can be done.
I love the pink. Of course, pink is the color for breast cancer awareness. What one last thing do you want to make sure people hear?
I think that the biggest thing is to say something. If you see something new on the breast, don't dismiss it to we're getting older or we've lost weight, gained weight. When we start seeing changes, the best time to act on it is immediately, so that we can hopefully take a situation and make it less complex.
That's good. Thank you so much.
Thank you for having me.